when you decide to quit, and hopefully you guys will never start. But if you do, hopefully you decide to quit before it's too late.
Hi, my name is Jennifer Silva. I am currently in Union Mine High School.
Hi, I'm Kat Kennedy. I dropped out of Union Mine High School.
Hi, I'm Vince Boss. I work full-time.
Where'd you go to high school?
I went to high school at Charter Community School.
And before you were there, where'd you go?
I went to El Dorado High School, but I got kicked out being dad.
I'm Sharon Stone. I just have tooth pulled. I went to Union Mine until I got kicked out.
Okay. And what do you think was one of the main reasons that you three, not you, you're not in trouble for anything, so keep it that way. What do you think was the main reason that you folks got kicked out of school?
Drugs.
Drugs, yeah.
Drugs.
Drugs and drinking. Drinking at a young age, so that probably wasn't a good idea.
What drugs were you using?
Well, everything I could get my hands on when I was younger, pretty much.
Were you able to buy them in school?
Oh, yeah.
What did you do when you were in school?
I usually didn't do them at school. I usually ditched school to do them, which really got me in that got me in the most trouble. It's not going to school, so.
I just did it behind the library.
I'm in the counselor's office.
Yeah,
I was too scared to do all that.
same spot at Union Mine, so.
A lot of people say that, there's not drugs in school, but they're not aware that there is. There was problems for my mom when she was in high school, drug problems for me in high school. There's problems for the kids now in high school. It's all out there and it's horrible. There's too much.
I think kids start drugs for boredom, attention, to fit in, all that, and it's just not right. I started because of depression, and I didn't have anyone to talk to, so maybe if you talk to your kids, they'll stop too.
A survey in the El Dorado County School District shows that 1% of 9th graders and 1% of 11th graders have used methamphetamine within the last 30 days.
If you count Ponderosa, El Dorado, Oak Ridge, and Union Mine, that comes out to about 75 kids.
Like that.
Don't think that these kids are doing it by themselves. They're sharing and they're telling their friends that this is the drug to be taking, and that's wrong.
It's really sad to think that some of these people are trying to influence my friends and even me to do drugs, and that makes me really sad.
I'm Shannon Stone. I went to Union Mine High School and I started using methamphetamines as a freshman. I believe I was 14 years old. I'm now 20, almost 21. I've been clean for about 4 years now, and the immediate, or how would I put that, although you don't think drugs might not affect you, it might not do it immediately to your body on the outside, but it immediately affected my teeth. I might not have taken the best care of them, but that did not help it at all. It made it a lot worse. I really don't know.
Why are you here today?
I'm here because of how bad my teeth are. I've had a lot of pain. The two days now, my face has gotten swollen. I've had to go to the emergency room for 3 times this month alone because of one tooth that's just falling apart. All my teeth pretty much are falling apart on me. They have no more structure. All the enamel's disappearing on them. And it's really hard because you need those to eat every day, It's really painful, and I don't like waking up in the middle of the night dealing with all this pain. And it all, again, goes back to the drugs that I experimented with.
Well, guess what?
What?
We're going to take your teeth out.
That's good. Now get it out. Because it hurts.
All right, let's get going. Let me look at your x-ray for just a minute, okay? And we'll talk about this.
Okay.
Okay, so if you look over here, Shannon, okay, you'll see that the big problem you have on this tooth is you have an abscess resulting from really deep cavities, and started a root canal some time ago. Since then it's been swelling up and swelling up and swelling up, and now it's been a while, and this tooth's pretty hollowed out, so we're going to take that one out for you.
Okay.
Okay, and you can see there's not a whole lot left of the internal structure of the tooth. It's pretty much nothing more than a shell anymore. Okay, but I want to point out something else on your x-rays. You see down the bottom you've already lost the bicuspid, and of course our goal is that we don't want you to lose any more teeth if we can avoid that. Okay, and what you can't see on the x-rays here is that you have several teeth that have areas with cervical decay, which is something that's almost pathognomonic or very commonly seen in people that were using amphetamines. So we're going to take a look inside your mouth in a little bit and try and fix one tooth, and we're also going to take that other one out for you today. And what you can see here is on the second molar, she's got cervical decay, which is really attacking the tooth. And if we look down toward the bottom, open up just a little bit and turn toward me. That's it. She's got cavities on her lower first molar and on the biting surface and the facial surface of her lower second molar. Cavities on the upper left side got so bad that she ended up needing a root canal, and that's the tooth that is in pretty bad shape today. We're going to be pulling that out later. But additionally, we have cavities down here on the lower left side on her first and second molar, and on the upper, and this is the tooth we're going to be taking out later. This is that root canal that's not doing so well. I want this to be the last tooth that you lose ever.
Don't do drugs, it hurts.
Alright, hi, my name is Stuart Kate Harrington. I graduated from El Dorado High School in 1999. I'm going to be going to Loma Linda Dental School in a couple weeks, which will be September 2003. And I've been in the dental field for the last 4 years, and I've seen a lot of dental decay as a result of crystal meth and various other drugs. It's important to brush and floss your teeth daily and avoid any kind of drugs that will damage your teeth. Otherwise, they will end up like these teeth in this jar. Very beautiful.
Which drugs did you use?
Methamphetamines, crystal, crank. I just found out I have 17 cavities and 2 root canals.
How do you feel about that?
It's kind of crappy, actually.
No one ever told me it would ruin my teeth. So no one ever told me that I'd be 5 foot tall, 85 pounds at 19 years old either. I just figured it was something you do. My friends' parents were doing it and so were my friends, so I did.
But it's on campus.
Oh, it's definitely on campus. That's where I actually started. The first time I ever did meth was I did a line in the Union Mine bathroom with a girlfriend. So.
What do you do at the Union Mine bathroom?
Bathroom? Go to the bathroom and wash my hands.
And that's what you should be doing up there.
Hi, I'm Dr. Goodis, and been watching a lot of things on film today, and I'll just tell you, it really makes me feel bad. When I have to take out a lot of teeth on people. I have a couple of kids of my own, you know, and have a lot of young girls that work for me here, and it's really frustrating. We try to help them all. Sometimes there's just nothing we can do, and we lose a lot of teeth. So don't get involved with drugs. Stay away from them. Stay away from crystal meth. Stay away from everything that you can stay away from. Have a good time. Enjoy your life. But don't end up in my dental chair if you can avoid it.
I mean, I wish I would have known the overall outcome when I first started, or I would have never known.
Okay, let me show you some of the things on your x-rays that you'll be able to see, okay?
All right.
Come on over this way. Okay, if you take a look over here, you'll see that this tooth has a huge cavity in it. So it's obviously been neglected for a long time. And this is one of the ones that's going to need a root canal. And then we'll come over to the other side, and you see there's cavities between your front teeth up here. And once again, there's a large caries restoration there, and this is going to need a root canal. And this tooth is also probably going to need a root canal. So you may need up to 3 root canals.